Hi everyone, I am Dr. Richa Salim, consultant pulmonologist and respiratory physician. Thank you so much for liking my videos, and for more future updates please subscribe to my channel. Today in this video we will discuss about vaping. Vaping or use of e-cigarettes has come up in the last few years as a substitute to smoking. A lot of youngsters have taken up to vaping, but is it really safe to vape, or can it cause problems to your lungs? This is something which we will discuss in the video today. So what exactly is vaping? Vaping is an alternative to conventional smoking. There are few devices which are used. The most common is the e-cigarette, then the vapes, the vape pens, or the ENDS ENDS devices, which are electronic nicotine delivery systems. Most of these devices have three components. The first is the battery, the second is the cartridge, and the third is the atomizer or the heating device. The cartridge contains the nicotine, tetrahydrocannabinol, certain flavors which can be as per you, like mint and camphor, and so many flavors are available, and certain additives like glycerol, polyethylene glycol, and certain oils. So what happens is that when the person starts to vape, a little bit of the liquid from the cartridge goes to the atomizer, which heats it at very high degrees, converts the liquid to an aerosol, which is inhaled in the lungs. At present, we have generation first to fourth of e-cigarettes available in the market. So, is vaping safe? Vaping was considered as a safer alternative to conventional smoking until recently, when in September 2019, the Center for Disease Control and Prevention, the CDC, came up with a new illness and lung injury and termed it as EVALI, which is e-cigarette and vaping product associated lung injury, which they found in many patients who had been vaping, and it led to death of 57 of such patients. So what exactly is EVALI? When in a vape, nicotine and aerosols are created by heating at very high temperatures, so chemical reaction occurs, and which leads to an inflammation of the lungs. It was seen the lung fluid of all these patients had very high levels of vitamin A acetate, which the CDC thought was the culprit in causing lung inflammation in these patients. These patients presented with symptoms of coughing, shortness of breath, chest pain, increased heart rate, increased respiratory rate, nausea, vomiting, diarrhea. When they were investigated, their blood infection counts were found to be very high. Their liver enzymes were deranged. The inflammatory markers like the CRP and the ESR were found to be high in these patients. The X-rays and the CT scans of these patients showed infiltrates in the lungs with ground glassing, and these patients had low oxygens. So, when other infections and other diseases were ruled out and a history of vaping was taken, and these patients were evaluated, it was found that the lung fluid or the bronchoalveolar lavage which was done showed presence of vitamin E acetate in 57 of these patients. The treatment of vaping EVALI patients is oxygen, steroids, and some supportive medication. Apart from EVALI, the vaping is not recommended otherwise also, because nicotine is a substance which is very addictive, and it has been seen that in certain e-cigarettes the concentration of nicotine is very high, in fact much higher than a conventional cigarette. So it increases your dependency on e-cigarettes, and many patients turn back to smoking. Otherwise also, nicotine is not a very healthy product. It causes a surge of adrenaline in our body, which causes very high heart rate, and it can predispose to heart attacks. It has also been seen that vaping causes increased exacerbations in asthma and COPD patients, probably by causing increased inflammation of the lungs. It has also been seen that since the emergence of e-cigarette, there has been an upsurge of smoking cases in the high school children by as high as 900% in the United States. Teenagers have taken up to smoking of e-cigarettes, which is very harmful. Secondly, although it has not been proven scientifically as yet, but heating at high temperatures can produce certain carcinogens in the aerosols and vapors of the e-cigarettes and can predispose to cancers. So, because of all the potentially lung damaging side effects that vape can cause, use of e-cigarettes or vape is not at all safe and it is not at all recommended. In fact, India has banned the production, sale, import and export of e-cigarettes in 2019. It is also banned in many of the foreign countries. So, if you have any of these symptoms and you have been vaping or you've vaped in the past 90 days, then please consult your doctor and tell your history very truthfully so that we can treat you accordingly. Also, instead of using e-cigarettes to quit smoking, use other nicotine replacement therapies like nicotine gums, nicotine patches, nicotine sprays and inhalers. I have made a video on tips to quit smoking and use of nicotine replacement therapies. I will link it in the description box. I hope this video was useful, and if you have any doubts regarding vaping, then you can ask me and I will try and help you. Please do not vape. Stay happy, stay healthy. Thank you.